Hey guys, I'm Dr. Joe Borio, and I just finished my morning shift working with people, taking care of people as a chiropractor. And I had a woman in today that had received care now for a few months, and she had come in with some very significant challenges. She had chronic headaches that she's had for almost her whole life, certainly gotten worse over the last few years. She also had some difficulty with her breathing, sleeping, a lot of sinus, upper head sinus congestion. So we started with her with an x-ray. So we started an examination, took a history, and we got an x-ray of her to identify where in her spine she may have misalignment of the bones, the vertebrae, that would cause pressure to the nerves. So what I wanted to show you is I want to show you her x-ray. I think that's going to be really important for you guys to see for a minute. But before I show you that, I want to show you a normal x-ray or an x-ray of a healthy spine or a healthy neck. So if you can see this here, and I'm on a selfie stick going over this. But when you look at this here, you're going to see there's the skull, and then you're going to see this beautiful arc in the neck. You're also going to see there's spaces here in the neck where there's a gap, and that allows for the nerve that comes out of that area to be opened up. So when I show you this area, this model, you're going to see the bone, and then the nerve where it comes out. And that nerve is like, essentially, it's a telephone wire. It's a group of wires that comes out. And as you guys know, right, it tells your body what to do. It sends messages through there to tell your body what to do. So when we look at this x-ray, now this is a woman who comes into my office. So I want you to look at her x-ray now real carefully. And when you look at this x-ray, you'll see why at least her nervous system, her body's ability to control her breathing, her sinuses, why she was having chronic headaches. When we look here, you're gonna look at her neck. Do you see how it has no curve in her neck? She has essentially no curve. And then these spaces down here, and she's young, she's in her 30s. So the spaces down at the bottom of her neck are narrowed, and she has no curvature in her neck. So what's happening to those nerves now, right, is there's compression, or irritation is probably a better word. A lot of times people call it like a pinched nerve, but in reality, there's compression to those nerves. So now your brain is trying to send messages to different areas of the body, and those messages aren't able to get there. So now she's born or develops misalignment in her neck, probably from birth, which is such a common cause of misalignment or subluxation in your neck. That's what it's called. It's called a subluxation, when your spine's out of alignment. Like if your knuckle was dislocated, right? Your spine will subluxate. It'll move out of normal position. And so her spine's subluxated, the nerves are being irritated, and the joints now are deteriorating. And now she's got these health problems that are developing, and they're developing over a period of time, and they're greatly diminishing her health. So now she's got chronic problems, chronic health issues, chronic sickness and disease that's developing in her body. So we started adjusting her, right? So as the chiropractor is kind of like, I think a great analogy would be like an orthodontist, right? So we're looking at the spine being crooked, much like your teeth would be crooked, right? And then we're going to use a series of adjustments. We're going to use a series of very specific alignment. We're going to push on that vertebrae to move it back in a better alignment. And as we did that over a period of time, it starts to take the pressure off of those nerves. So why I wanted to share that case with you, and I'm going to start doing this on a frequent basis in the week. This woman comes in. Now think about this. You're a person that feels lousy all the time. She's taken a handful of pills throughout the week. She just doesn't feel good. Her relationship is affected with her spouse. Her relationship as a mom, so with her kids, her body's not working nearly as well as it's supposed to. She starts receiving care here, and what happens? Geez, my headaches go away. My digestion's better. My sinus and congestion problems are better. I'm sleeping better. So my daytime, my ability to pay attention, to be empathetic and patient with my children, right? Or at work, all of those things greatly improved. So the quality of her life had dramatically improved over the period of the few months that she's received care. And one of the great things with her case was through our conversation and her earning trust in our office, she then decided to bring her children in. And we actually just did another newborn today that was suffering from colic, and their newborn received Sophia. She got her first adjustment. She's 2 months old, so she's 8 weeks old, and she got her first adjustment, which greatly helps with colic. So I was really excited to share that with you, because I think too often I see too many people suffering from health problems, health challenges. I think, with the best of intention, no judgment, we're kind of brought up in that medical world, so we're often going to that medicine box, or we're going to our urgent care, or, we're so busy, right? And we're so stressed. And we were like, God, if I could just take this pill and make it all go away, everything would be better today. And then all of a sudden, you don't even know how you get there. And you're like, geez, months have gone by, and now you realize you're taking a whole handful of pills many times, and you're just getting sick, or your body's not feeling so good. So what we do here in the office as a chiropractic office is we allow your body to work better. So chiropractic care, getting adjusted, kind of like eating good and exercising, it's so good for you. It's not even about back or neck pain. It's getting adjusted because it's good for you. It allows your body to work better. Your kids are healthier. You're healthier. Studies show you're less likely to take medication. Your body energy is better, your thinking's better, your overall immune system is dramatically improved, and that's exactly what this young lady experienced. So I was excited to share that with you guys today. So listen, if what I say resonates with you, and you're local in our area, I'm in Central New York, I'd love to have the opportunity to meet you, talk more about what I do as a chiropractor, and love to have you part of our office. It's always an honor to take care of people. If you're not, by all means, hey, listen, make a message down below or reach out to me and let me know where you live. I'll certainly try to find a chiropractor in your area, whether you're here in Central New York or whether you're, in Florida or California or Canada, wherever. And I'll make sure I find somebody that's going to take really good care of you and your family so that you guys can live a healthier life and live a more fulfilled life. That's certainly what I would love to do for you. So don't hesitate. Make a message below. You can certainly reach out to me on Facebook. We'd also love for you to like and share any of the videos that we post. So anything I've got posted, any of my memes that I'm posting on a regular basis, don't hesitate. Like it, share it, make an effort to try to help somebody out. Maybe it's not pertaining to your health challenge, but maybe there's a health challenge that you know of in a family member, a loved one, and it could offer them a little bit more information to take better care of themselves. So listen, love you guys for living a great life, certainly in trying to live a healthier life. Thanks for watching, tuning in. You guys need me for anything, don't hesitate to reach out to me here right on Facebook or give our office a call at the link above. In the meantime, I'll talk to you guys tomorrow. I'll go over another case. I'm going to go over a case every single day here in the office. I'm excited to share it with you.